Welcome all, and thank you for joining us in this webinar on meaningful use. My name is Farhan, and I am one of the health information technology professional here at MTBC. I also have a co-presenter, Mohammed Shahrukh, who is a meaningful use coach. This webinar is about CMS New Proposed Rule for meaningful use stage 1 and meaningful use stage 2, hardship exemptions and penalties. In today's webinar, we will show you how MTBC can help you avoid the penalties and implement MU objectives into your current workflow. Before we get into the details, let me first begin by telling you that you have joined this session on the GoToWebinar service. You can see a GoToWebinar panel on the right-hand side of your screen. This service allows you to ask questions using the GoToWebinar panel. If you need to minimize the panel or get it out of the way, use the orange arrow that is pointing towards the right-hand side of your screen. This will minimize the panel and will allow you to see the screen as much as possible. If you want to ask a question at any time, there is a question section of the GoToWebinar service. You can open up the questions section, enter your question, and submit it, and we will try to answer all of your questions at the time they're asked or at the end of the session when there is time for questions and answers. If for some reason we are not able to get to your question during this webinar, we will respond to you by email or we'll give you a call. Let me also tell you a little bit about our company. MTBC is in business since 1999, and we have clients in almost all the specialties in 43 states across the country. We have more than 1,200 employees and have 24/7 operations. And our technical support, client relationship is also available 24/7 to help clients with their day-to-day questions, problems for all of our products and services, and we also have a 24/7 patient help desk to assist patients with their billing and E.H.R related questions. We have been among Deloitte Technology Fast 500 company for the last 4 years. We are also Microsoft certified gold partner. We are an N500 5000 company for the last 3 years. We are also a SureScript certified solution provider, and last but not least, we also have a 2014 edition ONC certified E.H.R, which means that it will surely help you achieve your meaningful use incentive. In today's webinar, we will give you a brief introduction into the CMS New Proposed Rule for the providers who are participating in the Meaningful Use program. We will also give you an overview of the Meaningful Use Hardship Exceptions, and we'll show you MU Stage 1 and Stage 2 measures. We will also walk you through the MTBC coaching plan to assist you for meaningful use stage 1 and stage 2, and finally we will introduce you to different products and modules that are designed to meet the growing requirements of meaningful use. Let me first tell you about the new proposed rule by Center for Medicare and Medicaid Services, who have recently released a notice of proposed rulemaking that would allow providers participating in the E.H.R. incentive programs to use the 2011 edition or 2014 edition of certified E.H.R. technology for the 2014 reporting year. Now, if finalized, this proposed rule will provide participation options that vary by a provider's stage of meaningful use and by their certified E.H.R. technology edition selection. So the providers who are currently working on stage 1 in 2014 would be able to demonstrate stage 1 2013 edition using 2011 edition certified E.H.R. technology, or using a combination of 2011 and 2014 edition certified E.H.R. technology. Or means, if your E.H.R. is not certified for 2014 edition, you can still use the 2011 edition E.H.R. to meet the meaningful use requirements. If finalized, the proposal would allow providers to meet stage 1 or stage 2 of meaningful use with E.H.R. certified to 2011 or 2014 edition criteria, or a combination of both editions. Now, providers who are currently working on stage 1 and in stage 2 in 2014 would be able to demonstrate, instead of stage 2 criteria, they will be able to demonstrate meaningful use using the stage 1 2013 definition, using 2011 edition certified E.H.R. technology, or using a combination of 2011 and 2014 edition certified E.H.R. technology. Now, the stage 1, they will also be able to demonstrate stage 2 using stage 1 2014 edition using 2014 edition certified E.H.R. technology, or stage 2 2014 definition using 2014 edition certified E.H.R. technology. Now, this proposed rule also includes a provision that would formalize CMS, which is Center for Medicare and Medicaid Services, and Office of the National Coordinator's recommended timeline to extend stage 2 through 2016. If finalized, the earliest a provider would participate in stage 3 of meaningful use would be 2017. Means you cannot start participating in stage 3 before 2017. Now, the comment period for this proposed rule is currently open. Center for Medicare and Medicaid Services and ONC invite the public to submit comments before July 21st, 2014. I will now hand over the mic to Mohammed Sharloh, who is going to walk you through the hardship exceptions. So just bear with me for a second. I'm going to hand over the mic to him.
Hello everyone, my name is Mohammed Sharloh and I'm one of the meaningful use coaches here at MTBC. I would give you guys initially a brief introduction about what exactly the hardship exception application is, and then I will walk you all through to the details of it. So as part of the American Recovery and Reinvestment Act of 2009, Congress mandated payment adjustments to be applied to Medicare-eligible professionals who are not meaningful users of certified E.H.R technology under the Medicare E.H.R incentive programs. These payment adjustments will be applied beginning on January 1st, 2015 for Medicare eligible professionals. Medicaid eligible professionals who can only participate in the Medicaid E.H.R incentive program, they do not bill Medicare, are not subject to these payment adjustments. Eligible professionals who can participate in either the Medicare or Medicaid E.H.R incentive programs will be subject to the payment adjustments unless they are meaningful users under one of the E.H.R incentive programs in the time periods. Now, if a provider is eligible to participate in the Medicare E.H.R incentive program, they must demonstrate meaningful use to avoid a payment adjustment in either the Medicare E.H.R incentive program or in the Medicaid E.H.R incentive program, depending on their eligibility, of course. Medicaid providers who are only eligible to participate in the Medicaid E.H.R incentive program are not subject to these payment adjustments. Now, the hardship exceptions application. Initially, I would just let you all know what exactly the hardship exceptions is all about. This is basically a set of approved excuses for not being able to participate in the meaningful use program. What the CMS has done, they have introduced the hardship exceptions to take into consideration factors that made it not feasible for providers to be able to meet the meaningful use requirements. Hardship exception application also allows physicians and other eligible professionals to provide a detailed explanation so that they can avoid penalties in 2015 if they fail to show meaningful use of electronic health records in 2013. For eligible professionals who have not previously participated in the meaningful use program and are now willing to participate for the current year, they should successfully attest until October 1st, 2014. I'll emphasize on the date once more, it's October 1st, 2014. This would allow the EPs to avoid the 1% deduction in their Medicare claims. Furthermore, eligible professionals who were unable to participate previously in the meaningful use program can apply for a hardship exception application no later than Eastern Daylight Time, July 1st, 2014. Now, the exempted specialties that the CMS has devised that actually explains that certain specialties are automatically exempted for the hardship exception application. Basically what I mean by that is that EPs that do not need to fill the hardship exception application, and they will be automatically exempted from the payment adjustment that would be in the year 2015. So if an eligible professional is classified in the Medicare provider enrollment and chain and ownership system, that is PCOS, as having one of the following 5 specialties with their respective codes, and having the following 5 specialties as their primary area of practice, they do not need to submit the hardship exception application. They will automatically be granted hardship exception and will also get exemption from the 2015 payment adjustment based on the data in the PCOS. Now, the exempted specialties are diagnostic radiology, nuclear medicine, interventional radiology, anesthesiology, and pathology. Now, the new eligible professionals will be granted hardship exception automatically. It would allow them an exception for the payment adjustment year 2015, and similar is the case for hospital-based eligible professionals, that they would be automatically exempted from the 2015 payment adjustment. An emphasis should be the data that is based on, in the PCOS. That would be a base to define and to exempt the new either eligible professionals or hospital-based eligible professionals. Now, the doctors or eligible professionals who are dealing in the practices that are mentioned in this slide, that is the doctor of medicine or osteopathy, doctor of optometry, doctor of dental surgery or dental medicine, chiropractor, or doctor of podiatry. These practices or eligible professionals who are practicing these specialties will be eligible for a penalty if they do not participate in the meaningful use program or apply for a hardship exception application. Now, I will let you all know the reasons for the applications. Now, what are the bases on which an eligible professional can actually apply for a hardship exception? There are several reasons, and I would walk you all through in detail with every single one of them. The first one that you can see on your screens as well, that is lack of infrastructure. Now, what it means by lack of infrastructure is that an eligible professional may request this type of hardship exception if during any 90-day period starting from January 1st, 2013 to July 1st, 2014, the eligible professional practiced in an area without sufficient internet access to comply with the meaningful use objectives requiring internet connectivity and faced significant amount of barriers to obtain sufficient internet connectivity. The other one, that is the unforeseen or uncontrollable circumstances. In this case, an eligible professional may request the hardship exception if during 1 or 2 calendar years, that is 2013 and 2014 of course, preceding the payment adjustment year 2015, the eligible professional faced extreme, unavoidable, and uncontrollable circumstances that prevented the eligible professional from becoming a meaningful user of a certified E.H.R. The examples can be disaster, practice closure, bankruptcy or debt restructuring, E.H.R certification, or vendor issues. Now, another reason for the application could be lack of control over the availability of certified E.H.R technology. Now, what that means is that an eligible professional can request this type of hardship exception if they had a difficulty meeting meaningful use during the period January 1st, 2013 till July 1st, 2014. Because the EP practices at multiple locations and is somehow unable to control the availability of a certified E.H.R technology at one such practice or a combination of practice locations. Also, if the location or locations constitute more than 50% of patient encounters. Now, the other one is lack of face-to-face interaction. In such case, an eligible professional can apply for a hardship exception if they had a difficulty meeting meaningful use during the period that is again January 1st, 2013 till July 1st, 2014, and meets both of the criteria, that is, lack of face-to-face interactions and lack of need to follow up with the patients. The eligible professional must demonstrate either a complete lack of face-to-face interaction and follow-up, or that the cases of face-to-face interaction and follow-up are extremely rare and not part of the EP's normal scope of practice. Now, the application guidelines and deadlines. The links are mentioned in the slide, and they can be provided via email and through other means as well. And it says that the application must be submitted electronically, which is strongly recommended as well. And the deadline is the midnight Eastern Daylight Time on the appropriate deadline of July 1st, 2014 for all eligible professionals. Now, I would hand over the mic to Muhammad Farhan, and he would take you further with the rest of the Meaningful Use program details. Just hold on.
Thank you, Charles. Let me start with the E.H.R. incentive program overview. Now, the E.H.R. of 2009 authorizes the Center for Medicare and Medicaid Services to provide financial incentives to eligible professionals and hospitals that demonstrate meaningful use of certified E.H.R. technology. And in general, you will be considered a meaningful user during the E.H.R. reporting period in a payment year if you use certified E.H.R. technology to capture, exchange, and report specific information. And if you are an eligible professional, you should go ahead and get yourself registered, and after meeting the meaningful use requirements, get yourself attested, and the MTBC dedicated meaningful use experts can always walk you through the process. You can always give us a call, and we'll be more than happy to assist you. Now, to get into the details of the meaningful use, the Center for Medicare and Medicaid Services E.H.R. incentive programs are staged in 3 steps with increasing requirements for participation. Stage 1 focuses on data capture and sharing. Stage 2 focuses on advanced clinical process. And Stage 3 will be focused on improved outcome. Eligible professionals begin participating by meeting the Stage 1 requirements for a 90-day period in their first year of meaningful use and a full year in the subsequent calendar years. So if you want to start meaningful use, you will start with Stage 1 and then move on to the next stages as you go along. To receive the full incentive amount, which is $43,720, eligible professionals participating in the Medicare E.H.R. incentive program must have attested for meaningful use in 2011 or 2012. Eligible professionals who start the meaningful use programs in 2013 or later can receive reduced incentives up to $38,220. If the eligible professionals start for the very first time in 2014, they will get up to $23,520. However, because all eligible providers must upgrade or adopt newly certified E.H.Rs in 2014, all of these providers, regardless of their stage of meaningful use, are only required to demonstrate meaningful use for a 3-month or 90-day E.H.R reporting period in 2014. Eligible professionals participate in the program on the calendar years, while eligible hospitals and critical access hospitals participate according to the federal fiscal year. Moving on to the next slide. Now the CMS expects physicians to meet meaningful use measures for all patients seen during the E.H.R reporting period, including both Medicare and non-Medicare patients and private payer, non-Medicare or Medicaid patients in order to qualify for Medicare or Medicaid E.H.R incentive program. It is important for physicians to know that the Center for Medicare and Medicaid expects physicians to meet the meaningful use measures for all patients seen during the E.H.R reporting period in order to qualify for Medicare or Medicaid E.H.R incentive programs. Now, physicians who are not participating in Medicare but are interested in receiving incentive for using certified E.H.R technology are eligible as long as they submit claims to Medicare for Part B physician fee schedule service on behalf of Medicare patients to whom they furnish services. Physicians must also successfully register and demonstrate meaningful use of certified E.H.R technology. Now, the calculation of a physician's incentive payment will reflect claims for all services reimbursed under the Part B physician fee schedule, regardless of whether the physician accepted assignment on those claims or not. In the next slide, there's a table that will explain how much a provider will receive in each calendar year. So if you started in 2011 or 2012, your incentive amount under Medicare was $18,000. If you started in 2013, it was $15,000 in the first year and $12,000 in the second year, $8,000 in 2015, and $4,000 in 2016. Now, Medicaid eligible providers, they can start any time, and their incentive amount is going to be the same. So if you start in 2011 or 2012 or 2013 or 2014 or 2015 and so on, your first incentive payment is going to be the same, which is $21,250, which will be up to $63,750. Let me also remind you about the penalty, as we have talked about it in our previous webinars. Those providers who haven't started the meaningful use yet, the last year to earn the meaningful use incentive under the Medicare is 2014, and they have to complete the attestation before October 1st, 2014 to avoid the penalty. Or they can, of course, apply an exception if one of the reasons is applicable to their practice. If they fail to do so, Medicare will start penalizing them in 2015, and it will be 1% in 2015, 2% in 2016, 3% in 2017, and after 2017, the penalty will be 5% of the total allowed Medicare charges. So it is extremely important to start participating in the meaningful use incentive program before it's too late to avoid the penalty or to earn the incentive, of course. Now, as I mentioned previously, that there are different stages of meaningful use. Stage 1 of meaningful use has 13 core measures. Means that they are all mandatory measures unless your specialty doesn't perform one of those measures in their practice. And there are a total of 9 menu measures, means the optional measures, and you have the option to choose any 5 out of these 9s. And those 13 measures are, number 1 is computerized provider order entry for medication orders. And then it's implementing the drug-to-drug and drug-to-allergy interaction checks. And then it's maintaining an up-to-date problem list of current and active diagnosis. Now, talking about some of these measures, if you are, MTBC E.H.R user, you can meet almost all of these requirements if you are documenting the charts for every encounter and sending e-prescription. So if you are doing these 2 things in the MTBC E.H.R, you will meet 90% of the meaningful use automatically. Like if you look at the list here, with almost 5 of these measures, it says that in the MTBC module, it's e-prescribing to meet those measures. One of which is, computerized provider order entry. So if you are e-prescribing, you will meet at least 5 of these meaningful use requirement, which is generate and transmit permissible prescription electronically, maintaining an active medication list, and implementing drug-to-drug and drug-to-allergy interaction checks. Now, these checks are enabled in the MTBC E.H.R by default, and every provider who gets the E.H.R, these interaction checks are already enabled in it. And then if you move on to the menu items in the next slide, you will notice that that there is also a measure. Actually, 2 of these measures can be met by simply e-prescribing, and the rest of these measures can be met by either creating a chart and putting in the allergy, vital signs, or problem list in the chart. You will meet that requirement as well. Now, MTBC has a meaningful use dashboard, which is extremely easy to use. Now, this dashboard lets a provider keep track of steps to actually achieve meaningful use compliance. Each time the dashboard shows that a criterion is satisfied, the provider is 1 step closer to achieving the meaningful use, incentive. And here is a screenshot of the meaningful use calculator for stage 1. If you look at it, it shows core measures and the menu measures in different sections. So if a measure is met, it will be in the green zone. If a measure is not met, it will be in the red zone. So you can actually keep a track of what you are doing with the meaningful use in any selected reporting period. Let me also give you an overview of meaningful use stage 2. Starting in the year 2014, those providers who have met stage 1 for 2 or 3 years will need to meet meaningful use stage 2 criteria or objectives. Regardless of the participating year, all providers need to perform the meaningful use for 3 months reporting period, and that should be fixed to the 2014 calendar year quarter as mentioned in the stage 2 final rules. But if the new proposed rule is finalized, about which we talked earlier in this presentation, then the providers who are on stage 2 in 2014 can still use the stage 1 criteria and use the 2011 edition certified E.H.R to meet those stage 1 requirements for stage 2. Now, the stage 2 objectives are more focused to improve patient care through better clinical decision support, care coordination, and patient engagement that will result in better clinical outcomes, increased transparency and efficiency, and more robust research data on health system. So the stage 2 requirements are actually the expansion of the basic stage 1 criteria. Now, some of the objectives like the access of patients to view or download their health information, clinical lab test results, generating the list of patients by specific conditions, education resource, medication reconciliation, and immunization registries are the many objectives in the stage 1 objective, but for the stage 2, they have been moved to the core objective. Now, we'll take a brief look at the stage 2 requirement of meaningful use. Now, first of which is provide patients with the ability to view, download, and transmit their health information. So this measure could be met by using MTBC E.H.R, MTBC Patient Portal, where your patients can go online and view their health information, download it, and transmit their health information to a different provider. And one of the requirements is to incorporate clinical lab test results into the certified E.H.R technology. So if you are an MTBC client and using an MTBC E.H.R, we can help you meet this requirement quite easily by helping you create an interface with the lab of your own choice. And if for some reason your lab is not accepting the interface, you can still meet the requirement by simply putting in the orders and results in the MTBC E.H.R, or any E.H.R for that matter. There's also a requirement for providing summary of care record for each transition of care or referral, and you can also, meet this requirement by using MTBC E.H.R easily. All you have to do is simply go to the export option, and it will give you the ability to either transmit the file electronically or get a PDF or a human readable version of it and give it to the patients. And then there is a requirement for imaging results that should be accessible through the certified E.H.R technology. By using MTBC E.H.R, you can meet this requirement by simply attaching the results in the document module, or within the lab result itself, or within the lab module. There's also a requirement for recording the electronic notes in the patient record. You can also do it in the charts. So if you're creating a chart and putting in your notes in the plan of care section or the chart note section, this requirement will be met automatically. And there is also a requirement for recording the family history. And you can always do that by simply putting in the family history in the family history section. Now let's take a brief look at the meaningful use stage 2 calculator. Here again, the core and menu measures are divided in two sections. And if you look at the statistics, it will show the numerator and denominator. So if you look at demographics, for example, it says 412 out of 416. Means you have entered demographics for 412 patients out of 416. So 412 is your number of patients, or you could say the numerators, for which you recorded the demographics. And the requirement for this measure is 80%, as you could see it in the required value column, and it is met by 99%. So this provider is on the track, and once again, if you are not meeting a particular requirement, that measure will be showing in red. Means you have to work on it and meet the requirement. If you have met the requirement, then it will be in the green zone, as you can see it in the screenshot. So the difference between stage 1 and stage 2 is that in stage 1 there were 13 core objectives for eligible professionals and 5 out of 9 menu objectives, and a total of 18 objectives. And in stage 2, eligible professionals need to meet 17 core objectives and 3 out of 6 actually menu objectives, and a total of 20 objectives. Now, let me also give you a brief introduction to the MTBC Care Connector. It is a MTBC patient engagement solution, so you can involve your patients to use the P.H.R. and use the eye-checking software to comply with the stage 2 requirements of view, download, and transmit, and send secure messages. So you can tell your patients to actually communicate with you using the secure messaging module from the P.H.R. instead of making a call or sending you the letters. If they send you the message from the secure messaging module, you'll be able to see it within your E.H.R. and you can respond to it right away. And there are certain other solutions available for your patients. It is called a toll-free helpline, a 24/7 patient help desk for your patients. They can give them a call, and that particular help desk will definitely help them with any billing question or any technical question regarding the P.H.R. or the portal. And we also have a OMC certified web E.H.R. at no additional cost for all of our clients. So if you are MTBC client, you can get this E.H.R. absolutely free of cost. Not just the E.H.R. actually, all of these services, all of these solutions can be provided to you absolutely free of cost if you are a Practice Pro client. And there's also a solution called MTBC IRX. It's available on the iPhone and the iPad and also on the Android-based smart devices. So let's say you are in the market and or traveling, and you receive a call from the patients, asking for a refill or asking for a new medication. So you could go to that IRX application on your iPhone or Android and send the prescriptions right away, or send the refill request right away. So even if you are traveling, you could actually use your IRX application to prescribe your patients. There's also a service called E.H.R Scribe. So if you are using our transcription service, or if you're not using our transcription service, there's a service called E.H.R Scribe, which in the E.H.R system, all you have to do is simply send them the audio file recorded from your recorder, and they will incorporate the data into the E.H.R charts. So you can document all your visit in an audio file, and MTBC Scribe team will transcribe it and put it in the E.H.R for you in the appropriate section. You can also go to the Meaningful Use website to learn more about the program. It's available here is www.cms.gov/EHR-Incentive-Programs. And then you can also view our website, mtbc.com/meaningful-use.aspx. And you will have all the information that you are looking for. I will now take a small pause and retrieve all the questions that you have asked, and we will try to answer your questions as much as possible. So give us a moment. Okay, so here I am with the first question asked. The question is, do specialty providers have to meet all of the meaningful use objectives for the Medicare and Medicaid E.H.R. incentive programs, or they can ignore the objectives that are not relevant to their scope of practice? And the answer to the question is a yes, absolutely. They can definitely apply an exclusion for the measures that are not applicable to their specialty. For all the eligible professionals who participate in the Medicare and Medicaid E.H.R. incentive programs, they will have to meet all those requirements that are mentioned, but like I said, if it is not applicable to their specialty, for example, a podiatrist does not need to record the height and weight of a patient, they can definitely go ahead and apply an exclusion for it. So if you're a specialty provider, you don't need to meet all of the meaningful use objectives, but some of them are mandatory. For example, you'll have to still pull out a list of patients with a specific problem. So some of these are still mandatory, and there is no exclusion for it. Moving on to the next question. The question is, can eligible professional implement an electronic health record system and satisfy meaningful use requirements at any time within the calendar year for the Medicare and Medicaid E.H.R. incentive program? So that's a good question. Now, for Medicare EPs, a first payment year, the E.H.R. reporting period is a continuous 90-day period within a calendar year. So you could choose any 90 days from a calendar year if you're a Medicare provider. And you must satisfy the meaningful use requirement for 90 consecutive days within their the first year of participating in the program to qualify for an E.H.R. incentive payment. In subsequent years, as I've explained previously, the E.H.R. reporting period for eligible professionals will be the entire calendar year. But only in 2014, all the providers, regardless of their stage, have to meet the meaningful use for 3 months. And those 3 months should be fixed to a quarter. So if you want to participate in the program in 2014, you will have to start from January 1st and end your reporting period on March 31st. Or you start from April 1st and end your reporting period on June the 30th. But this is only in 2014. Now, the other question is that can eligible professional receive electronic health record incentive payments from both the Medicare and Medicaid programs? The answer is not for the same year. Now, if you meet eligible provider meets the requirements of both programs, they must choose to receive an E.H.R. incentive payment under either the Medicare program or the Medicaid program. So if you qualify for both programs, you will not get incentive for both programs. You will get it from either Medicare or Medicaid in the calendar year. But later on, you can always in the next year you can switch to either Medicare or Medicaid. There is also another question: is what is the earliest date the payment adjustment will start to be imposed on the Medicare eligible professionals that do not demonstrate meaningful use of certified E.H.R technology? Okay, so Medicare payment adjustments will begin in 2015 for all eligible professionals and eligible hospitals, of course, that do not demonstrate meaningful use of certified E.H.R technologies. But again, if you don't want to participate in the program because of some reasons, as we have mentioned previously, you can always go ahead and apply a hardship exception. Just bear with me, I'm retrieving some more questions. Okay, so the question is, do I have to be a meaningful user each year to avoid the payment adjustments, or can I avoid the payment adjustment by achieving meaningful use only once? Or by, okay, so it says by either achieving the meaningful use only once or by simply applying for the hardship exemption only once. The answer to the question is you must demonstrate meaningful use every year according to the timelines detailed above in order to avoid Medicare payment adjustments. We will send you this presentation and you will go ahead and take a look at it. You will take a look at that timeline. Now, for example, eligible professional who demonstrate meaningful use for the first time in 2013, they will avoid the payment adjustment in 2015, but will need to demonstrate meaningful use again in 2014 in order to avoid the payment adjustments in 2016. So you have to demonstrate every year to avoid the payment adjustments for that subsequent program year. The other question is that I am an EP who is eligible for both the Medicare and Medicaid E.H.R incentive programs, but I registered to participate in the Medicaid E.H.R incentive program. Do I still have to be a meaningful user to avoid the payment adjustments? This is a very, very good question. Yes, if you are eligible to participate in both the Medicare and Medicaid E.H.R incentive program, even if you register yourself under the Medicaid incentive program, you will still need to demonstrate meaningful use according to the timelines detailed previously to avoid the payment adjustments. And you may demonstrate meaningful use under either Medicare or Medicaid. So you have to demonstrate meaningful use if you are eligible for both. Moving on to the next question. The question is, how will I attest for the Medicare and Medicaid E.H.R incentive programs? Okay, it's very simple. All providers who are eligible to participate, first of all, they need to demonstrate meaningful use for 3 months or 90 days based on their program year or a full calendar year. And then you will have to go to this to the CMS web-based E.H.R incentive program registration and attestation system. If you are a Medicare provider, you'll have to go to the CMS website to first of all get yourself registered and then get yourself attested. It's called National Level Registry. But if you are a Medicaid provider, you'll have to get yourself registered on the CMS website and go to your state website to get yourself attested. Now, in the registration and attestation system, all the providers will fill in the numerators and denominators for the meaningful use objectives and clinical quality measures. There are different modules available where you can fill in this information, and you will need to indicate if they qualify for exclusions to a specific objective, and then attest that they have successfully demonstrated meaningful use. Once the providers have completed a successful online submission through the attestation system, they may qualify for a Medicare E.H.R incentive payment or a Medicaid E.H.R incentive payment. And MTBC Meaningful Use team can always help you out with that. They can give you the training anytime you need. You can give us a call or send us an email, and we will be more than happy to assist you with the training, and we'll definitely walk you through the registration and attestation process. The number for the Meaningful Use team is available on the screen now. It's 732-873-5133, extension 308, and you can also email us at any time. I think that's it for the day. I do have some questions here, but since we're almost done, and we will respond to those questions by email, or we'll give them a call if they have provided the numbers. So thank you all once again for joining us for today's webinar. Once again, if you have any questions, please feel free to give us a call, and we will be more than happy to assist you. Have a nice day all. Thank you.